was very fortunate to have been among the first OECS island to receive the AstraZeneca vaccine for administration to individuals 18 years and above. What we did as a ministry and country by extension was aimed at attempting to slow or stop the spread of COVID-19. Our control strategies targeted both elimination and mitigation, all in an attempt to lessen the effects of the virus on our people. We began the COVID-19 vaccination of our key population, and this was a new initiative. However, the process of administering vaccines was not something new to Dominica, since we have a well-organized, expanded program on immunization. Today, we are here for the launching of Dominica's digital COVID-19 vaccination certificate. I therefore extend a warm welcome to you, our invited guests, and thank you for gracing us with your presence. To those who are viewing and listening via the various media platforms, I also bid you welcome. As we continue with our program, I would now like to invite Dr. Kivian Burnett, the National Coordinator of the COVID-19 Vaccination Unit, to present an overview of the unit and its activities.
A pleasant good afternoon. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Lestrade Wyke, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Ravalier, Principal Nursing Officer, Dr. Fevrier Drago, Officer in Charge and the Director of Primary Healthcare Services, Mrs. Mignon Rose Shillingford, the Coordinator of the Health Promotion Unit, matron and staff of the Dominica China Friendship Hospital, Dr. Jermaine Japierre, Project Manager of the Caribbean Digital Transformation Project, Mr. Robert Tong, Coordinator of the Digital Economy. Ms. Florestine Lewis, EPI Manager and CHN, Senior Community Health Nurse for Region 1, other invited guests and media hostess, a pleasant good afternoon to you once again. The Commonwealth of Dominica continues to grapple with the impact of the COVID-19 pandemic. Since the onset of the pandemic, the Delta variant has been the widest and longest serving wave that we have suffered in the Commonwealth of Dominica. Straining the healthcare system due to increased rising of cases as well as hospitalizations and deaths, the socioeconomic impact of the virus also affects other areas such as schools, having to resort to virtual learning, businesses either having to close down or downsize, and the toll on physical and mental state of everyone living in Dominica. In response to this pandemic, the world saw the rapid development of vaccines against COVID-19 as an extraordinary achievement. However, many persons continue to be vaccine hesitant, or as we will say right now, vaccine resistant, and continue to spread misinformation regarding the safety and effectiveness of the vaccines. In light of these concerns, the Commonwealth of Dominica, through collaborative efforts with the Ministry of Health, Wellness and New Health Investment, assembled a COVID-19 vaccination unit with clear objective, which was 1, to identify the key populations at risk for COVID-19 and to ensure the distribution of effective vaccines within the Dominican population for prevention of COVID-19 infections. A complete and comprehensive communications plan was developed in aim of reaching the target population needed to cover persons who needed to be vaccinated. Our target population extended from children 12 years and over, especially with the introduction of that of the Pfizer vaccine, as well as other persons who were very skeptical of being vaccinated. We visit a number of schools over the island, as well as utilizing catchment areas and different health centers. We engage business entities, both for the public and private sector. sporting clubs, that of football, basketball, and as well as the religious communities to get persons vaccinated and to aid in sensitizing the public on the importance of getting vaccinated. We continue to reiterate the importance of getting vaccinated, that it does not prevent one from contracting COVID-19, but however, it decreases the risk of you becoming severely sick to COVID-19. This was the message that we gave to everyone on our daily travels throughout the communities and countries. The accessibility of COVID-19 vaccines was one of the main issues that a lot of persons brought about upon our traveling and engagement with persons. We then decided to do mobile pop-up sites as well as extended hours at different health centers in the given health districts. This in itself aimed to increasing our vaccination uptake. Dispelling myths and misconceptions about the COVID-19 vaccines was one of the key populations or key aspects that we as a ministry and a unit noted that persons were reluctant to get vaccinated because one is persons who had the conspiracy theory that it has a chip in the vaccines or the vaccines in itself gives you COVID. This in its daily presentation as well as at our different health centers and mobile pop-up sites were downplayed and as well as encourage persons to get vaccinated, and we have also seen an increase in the uptake. As of August 2021 to March 2022, the unit has established or has inoculated, over 25,000 persons. That includes the first and second doses as well as booster dose. We offer 4 types of vaccines in Dominica, and we continue to tell persons that it's important to get vaccinated to continue your livelihood as well as to protect yourself, your family, and your loved ones. We offer the Pfizer vaccine, which is suitable for children 12 and over, the Moderna vaccine, the AstraZeneca vaccine, and the Sinopharm vaccine. We also established a mobile unit where we have 2 buses traversing throughout the island, bringing the vaccines to the rural areas and especially persons who are in shut-ins or homebound persons as well. Today, we are here to talk about the digital vaccination certificate. This in itself is a tremendous achievement for the unit, seeing that we had an increase in number of vaccinations. So a proper way to have, to have a database where we can pull out all the vaccine records of persons as it pertains to COVID-19, as well as if we have any severe reactions from persons who got COVID, we could at least identify and make it easier for us to know how to manage moving forward. Also, with the world that is evolving in terms of travel, the digital vaccination cards in itself also helps persons to aid with the ease of losing your card as well as getting your card damaged and tampered with. The unit so far has been very thankful for the persons who have come on board as well as cooperated with us in terms of getting vaccinated as well as encouraging others to get vaccinated. Today, we'd just like to thank everybody who came on board to get vaccinated, and we encourage persons to. The vaccines are available to you free of charge in the Commonwealth of Dominica at all type 3 health centers and mobile pop-up sites that we are showing on our daily schedule throughout the Ministry of Health, Wellness, and New Health Investment platforms, and as well as the different social media platforms available in Dominica. Before I leave, I would just like to say a hearty thank you to all the nurses, the doctors, the CHAs, as well as the drivers and everybody who was actively involved in the vaccination unit and continues to spread the good word about the COVID-19 vaccines to all Dominicans. Thank you very much.
Thank you, Dr. Burnett. I would now like to invite our own Honorable Dr. Irvin McIntyre, Minister for Health, Wellness, and New Health Investment, to deliver remarks.
Thank you, PS. Let me recognize Mrs. Letitia Lestrade-White, our Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Mrs. Terry Ravalier, our Principal Nursing Officer, Matron Emma Matthew, Dominican China Friendship Hospital, Dr. Lenora Favre Drago, representing the Office of the Director, Primary Healthcare Services, Mr. Robert Tong, Coordinator, Digital Economy, Dr. Jermaine Japier, Project Manager, Caribbean Digital Transformation Project, Mrs. Mignan Roll Shillingford, Coordinator, Health Promotion Unit, Dr. Kivian Burnett, Coordinator, COVID-19 Vaccination Unit, Senior Community Health Nurse, Region 1, Florestin Luis, Manager, Expanded Program on Immunization, other staff of the Ministry of Health and Vaccination Unit, staff of the Information Communication Technology Unit, and other invited guests of the media. Pleasant good afternoon to everyone. As the Minister for Health, Wellness, and New Health Investment, I look back at just over 2 years ago. I cannot help but appreciate how far we have come in this battle against COVID-19. It was an uphill climb when we looked at the task at hand and faced the constant challenges this pandemic brought, with a fluid situation that was unpredictable, to say the least. Needless to say, we felt overwhelmed at times, but we were never discouraged or daunted. And here we are today, taking another step, not just in the COVID-19 battle, but in the upgrading of the healthcare system as a whole, with the launch of the digital vaccination card. In light of emerging trends around vaccination screening, the development of the digital card is timely, and it enables persons to provide proof of vaccination, which is increasingly becoming a requirement in accessing and conducting transactions. And we have to come to terms with those changes. The government of Dominica, through the Ministry of Health, has made healthcare a priority over the years, with the introduction of free healthcare services for those below 18 and for our senior citizens as well. The construction of 12 new health and wellness centers, with 3 more on the way. The erection of the Dominica China Friendship Hospital and the Marigot Hospital. It is evident that healthcare is of paramount importance to this administration. And the management of the COVID-19 pandemic in Dominica is another testament to that dedication. Even before our first case was confirmed, the government, led by the Honorable Prime Minister, engaged the Ministry of Health on a plan of action, and neither has relented since. We dedicated every resource available, both capital and technical, to education, prevention, and treatment, and as necessary, quarantine and isolation as well. We followed a pandemic plan. We took nothing for granted and were pragmatic in our approach. New structures were erected, equipped with the tools and human resources necessary to care for the patients diagnosed with COVID-19. Spaces were rented and retrofitted as needed. Testing equipment was obtained, making Dominica the first country in the Caribbean with the capacity to do PCR testing in the public sector. There was other PCR testing, but that was at CAFA and not necessarily in the public sector. That was in Trinidad. When vaccines were approved, no effort was spared to make Dominica one of the first small island developing states to procure vaccines. And today, we launched the digital vaccination card, which will facilitate travel and make vaccination information more accessible. The digital card is accessible via a mobile phone or other electronic device and is more accepted on international platforms. It's our hope that it won't just end with the COVID-19 vaccination, but that given the advancement in this digital age, much more of our healthcare information can be digitalized and we can move away from the paper-based records. That, of course, will make information easier to share and more accessible as we move towards telemedicine. It would be remiss of me if I didn't thank those who played such a critical role in the endeavor. The COVID-19 vaccination unit has worked very hard this year or so. The donors who came forward so willingly to provide the vaccines, the nurses, the doctors, and other medical personnel on the ground, and the general public who continue to come out and get vaccinated. I also want to thank the ICT unit who created the app for this hospital. This launch by no means indicates that the fight against COVID-19 is over, This is just another notch in our belts. The initiative forms part of our ongoing effort to augment the national COVID-19 vaccination program. The digital card is global, it is accepted, and will certainly place us amidst the world's population that allows freedom of movement as it relates to screening aspect. Let me repeat, the fight against COVID-19 is not over. We are in it for the long haul, and we must do what is necessary to protect ourselves, even if some restrictions have been relaxed. Your health remains your responsibility, so I continue to implore with the general public to take necessary precautions and not let your guard down. We urge those who have not yet done so to get vaccinated. Make that decision today. I now declare the official launch of the vaccination card. God bless.
Thank you, Honorable Minister. And I could hear the applaud, and I could see Ms. Luis is just smiling away. So with the official launch declared, I would now invite Ms. Vanella Ole, who is the Communications Officer in the COVID-19 Vaccination Unit, to demonstrate and lead you through the process of accessing your vaccination certificate.
Honorable Dr. Irvin McIntyre, Minister for Health, Wellness, and New Health Investments, Mrs. Letitia Lestrade-White, Permanent Secretary in the Ministry of Health, Wellness, and New Health Investments, Mrs. Terilia Ravalier, Primary Principal Nursing Officer, Dr. Lenora Fevrier-Drago, representing the Office of Director of Primary Healthcare Services, Mrs. Mignon Roll-Shillingford, Coordinator of the Health Promotion Unit, Dr. Kivian Burnett, Coordinator of the COVID-19 Vaccination Unit, Matron and staff of the Dominica China Friendship Hospital, CHN, Senior Community Health Nurse, Mrs. Florestine Lewis, who is also the Manager of the Extended Program on Immunization, other staff of the Ministry of Health, and as well, members of the Vaccination Unit, Project Manager of the Caribbean Digital Transformation Project, Dr. Jermaine Japia, Mr. Robert Tong, Coordinator of the Digital Transformation Project, other invited guests and media. Good afternoon. This afternoon, we are here to officially launch the COVID-19 digital cards. We are very happy and elated and excited to be here to bring this new initiative through the government of Dominica to the people of Dominica. This in itself shows that it's a milestone, and it's something that we are very proud of, and it's just one step closer to ensuring that we digitally transform the services and product offerings of the government of the Commonwealth of Dominica. So we officially launched the cards today, and it's a very quick, easy, and simple process to access the cards. So for this demonstration, we'll be using Jane Dawn as our client, so we'll go through the process. So the first thing that someone would have to do is log on to vax.dominica.gov.dm, and you enter in the details as stipulated. So you enter in the first name. For this exercise, we'll be using Jane Dawn, as I said. The first name, your last name, your date of birth is important. You also need to enter in an email address, which is where your cards will be automatically sent to you, your telephone number, and then you're also required to upload a government-issued ID. So it's either your Social Security, your driver's license, or the biodata of your passport page. You go ahead and click I am not a robot, just so that we can validate that you are actually a human being and not a robot. And then you go ahead and click search. What this does, it enables this website to search our database to access your card. Once this is found, you would receive a message as you have seen here, record found. Once this is done, you go to your email account, to access your card, which would have been automatically sent as you have seen here. If you read, it says, "Dear client, please click here to retrieve your digital vaccination card." Once you have done this and you have clicked, this is what your digital card would resemble. And I present to you your digital vaccination cards. If you look to your card, as you can see, there is a QR code. If this is scanned, this would bring up a complete history of your vaccination status. So we will show you what this would look like. This is your history. It shows your information, the doses, if you have gotten your first dose, your second dose, your booster, the dates of these doses. So what we also advise persons to do, once you have downloaded your card or once you have accessed your card, you make sure that the data entered is correct. So we ask you to look at your first name, your last name, your date of birth. Ensure that the data is correct. Once it is correct, you go ahead and click download comments. So this is where you let us know if your name is misspelled, if your date of birth is incorrect, and we would be able to make that amendment. If you have a physical vaccination card, you can go ahead and upload it so we can make amendments if necessary, and as well the government issued ID. And then you submit this to us. Within 24 to 48 hours, you would receive an email as to the status of your card. Now, when you search for your record, if for some reason you do not get a report that says vaccination found and you get record not found, we have a validation page as well that would populate. But before you go ahead and click here, we ask you to make sure that the data entered is actually correct, that you did not misspell your name. If it is correct, then you go ahead and enter this data into this validation page, the first name, last name, date of birth, an email address, telephone number, and of course your ID. You go ahead and click I am not a robot and search. We in turn will get an email, and within 24 to 48 hours, you would receive an email as to the status of your vaccination card. So with this, we officially present you with your digital cards, and we ask everyone to log in and download their new digital vaccination cards. Thank you.
Thank you, Ms. Ole, and as you heard it, we have officially launched our vaccination certificate, digital vaccination certificate. Ms. Ole, I tried mine and it works. So where you sitting there, Mr. Tong, yours worked? Very good. So just try it where you are and just give the thumbs up. It works. So it worked for me. So as we come to an end of our program, I would like to invite Ms. Sheena Harry, Communication Specialist in the Ministry of Health, Wellness and New Health Investment, and a staff of the COVID-19 Vaccination Unit.
Honorable Dr. Irvin McIntyre, the Minister for Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-White, Permanent Secretary within the Ministry of Health, Wellness and New Health Investment, Mrs. Terilia Ravalier, who is the Principal Nursing Officer, Dr. Lenora Favria-Drigo, who's representing the Office of the Director of Primary Healthcare Services. I recognize as well Mrs. Mignon Rule Shillingford, Coordinator of the Health Promotion Unit, Dr. Kivian Burnett, who's Coordinator of the COVID-19 Vaccination Unit, matron and staff of the Dominica China Friendship Hospital, SCHN Florestin Lewis, who's also the manager of the expanded program on immunization, as well as other staff of the Ministry of Health, and of course the vaccination unit. With us as well, Dr. Jermaine Jean-Pierre, project manager of the Caribbean Digital Transformation Project, Mr. Robert Tong, who is coordinator of the digital economy, staff of the Information, Communication and Technology Unit, that's ICT, other invited guests or media partners. Good afternoon, everybody. As human beings, we tend to think we've done everything on our own. We hear things like self-made, I got no help, it was all me. However, that is never entirely true. Somebody invested funds or even their time and attention to assist. And without giving thanks for blessings, no more blessings will come unto us. So that's why I've been tasked to give thanks. So let me begin by thanking the Honorable Prime Minister of Dominica, the Minister for Health, and also our Permanent Secretary for their support throughout this entire process. I'd also like to single out the Cabinet Secretary, Ms. Karen Prevost, specifically, because she has been a backbone for the vaccination unit during this time. I recognize from the vaccination unit, Dr. Kivian Burnett, Ms. Florestin Luis, Ms. Vernella Ole, and of course, the Data and China Friendship Hospital for hosting us so graciously. I would also like to thank our media partners for coming on board and accommodating us as always, and for all of you who chose to attend this event because you've recognized the importance of what we're doing today. And of course, I'd like to thank the general public for your continued patience. We know many calls have been coming to the health center about my card, my card. No, your card. So we would like to thank you for your patience, and we'd like to encourage you, as always, to continue to protect yourself, and we appreciate everything that everybody has done thus far in this battle. Thank you, everybody.
And with nothing much to add, just to say thank you, Ms. Harry, for presenting the vote of thanks. Thanks to all of you who attended. Thanks to the persons listening via the media. I just urge you now to just go ahead and get your digital vaccination certificate. Thank you.